Okay, let's go.
Welcome to Access with Lydie, where we explore the innovative practices in the healthcare industry advancing access to care. We ask our guests 3 questions that help us understand the why, who, and what we can do to support them in their initiatives. Our goal is to leverage our network to assist champions in addressing a challenge they are currently facing. Today, our guest champion is Dr. Alana J. Arnold. Dr. Arnold is a board-certified pediatric emergency medicine doctor, medical director, and founder and CEO of Premier Pediatric Solutions. Her work focuses on improving children's health in our community ERs and urgent cares, as well as giving families tools to gain health literacy. Dr. Arnold, it's a pleasure to have you.
Thank you so much for having me. I'm very excited to be here with you.
Your work is critical to healthcare for nearly, and if I'm correct, nearly 30 million children that passes through our ER systems each year. What made you prompt or decide to even create Premier Pediatric Solutions?
It really goes back to just my love of kids. With kids, they're very honest, fun-loving, resilient, and many of them don't seek medical care unless they absolutely need it. One thing that people don't realize is that children are not little adults. There's completely different physiology and different illnesses that they have. So you have to have specialized training to care for them in the best way possible. And I want to be very clear from the outset, this is not about the competency of the clinicians. It's just about, unfortunately, how the structure of our healthcare system is. So you have ER doctors who, go through their residency, but unfortunately, only about 10 to 15% of that residency actually focuses on children. 85% of children, when they seek medical care, they're going to go to their local ERs, urgent cares, and what have you. And that's where the issue arises, because most of these clinicians don't have specialized pediatric training. There has to be a better way to fill this huge void in medical care. And that's what prompted me to want to build the consulting work around Premier Pediatric Solutions to improve the clinical care that kids are receiving in their communities.
One, thank you for even thinking of this, because I'm a big believer in a lot of times what tends to happen is we see a problem, and because it seems so big, we're not sure exactly like how to even approach it or to even dissect it. Part of Medicaid is that they are also providing service for children. And when we're looking at the numbers, children at times are the ones who are suffering when it comes to access to care.
Absolutely.
And just being able to have an adequate, healthy environment in order to be their best selves, because the children eventually become adults. So
Absolutely.
we really want to ensure, and I appreciate what you're doing, and we really want to ensure that we're providing them with the best health outcome they can possibly have. We kind of dived into our second question, which is, from the outside looking in, what is the obvious impact you're hoping to make in the healthcare industry, and what is the nuanced impact you aim to make?
Yes, absolutely. The way I frame it, my consulting group is focused. There are 2 avenues that we're focused in. The one is the medical healthcare gap between the pediatric care and the community. This revolves around the concept of what we call pediatric readiness. Pediatric readiness, simply put, is the capacity for a facility to appropriately care for a child, stabilize them, and then if need be, get them to definitive care. The issue is that there are many children, as you said, nearly 30 million kids who pass through the ER system. They'll go to their local ER, and they don't have the proper tools to care for that child. Now, this not only leads to worse clinical outcomes, as you can imagine, but huge healthcare costs on the order of nearly $250 million spent each year in malpractice and litigation, and then also nearly $500 million spent in unnecessary EMS transfers. Not only clinically is this worrisome, but just financially, the healthcare system costs are way out of control. So what we've developed is a tech tool, a web app essentially, that is essentially a clinical support tool for clinicians who are seeing kids and don't have pediatric ER specialists on site. There are only 5% of hospitals in the country that are children's hospitals. So the vast majority of facilities are adult run, and they don't have that direct connection to pediatrics. So our web app allows the clinician to seamlessly and at their fingertips look up proper protocols to help care for that child. It's basically, like you said, phone a pediatric ER doctor. So this web app is really going to revolutionize how pediatric care is delivered in community settings. So not only with the web app, but also providing inventory checks to make sure they have supplies and equipment on hand, and then access to medical trainings for their staff. The second component that we're focusing on, and I'm very excited about, is really direct to consumer, meaning the families, the parents, the caregivers, to give them health education around taking care of their child better. So we are building a component called In a Minute with Dr. Alana, where we give them bite-sized content to understand really important topics for them. All of these points of contact are going to allow the families to feel empowered about how to best take care of their child. And it's going to be delivered in a way where it's going to be easy for them to consume and get that resource to help better care for their child.
That's awesome. That is honestly awesome. And I'm really glad, like I said before, I'm really glad that you have created this platform. Now we are at our final question. This is the one that we've all been waiting for. If you can summon the full power of the social media community, what current and practical challenge can we help you address?
Yes. So I would say there are two major components. The first is any contacts with healthcare executives or even payers and insurance companies would be fantastic to help us leverage to build our exposure around this critical issue for pediatric care. We are able to showcase that not only will we benefit clinically in terms of serving the kids, but also financially. They're going to see benefits in terms of their bottom line. And the second component would be any contacts in the community or local nonprofits would be fantastic to help us with our secondary component to do direct-to-consumer content for parents around children's health literacy and health education to make sure that they are given the resources to better care for their child and make sure that they can grow into happy, healthy adults.
Yeah. Thank you again, Dr. Arnold, for joining us today. If you would like to get in touch with her, our guest champion, please see her contact information in the description, and you can always comment below with your questions or recommendations for our guest. So with that being said, I want to say stay tuned for our next Access with Lydie, where we highlight the champions within our network improving access to care. Till we see each other again, have a good day.